department. Today we are having this very exciting topic from one of our service providers, Fertility Point. So let me welcome Faith from Fertility Point to start us with our word of prayer, after which I'll give you the program of PCB.
Thank you, Damaris. I'd like to send my special thanks for giving us this platform to learn and continue expanding our knowledge in regards to infertility treatment. My name is Faith from Fertility Point. I take care of corporate business, and together I have my team. That is our IVF specialist who is going to be the presenter of the day, Dr. Rajesh Chaudhary, and my supervisor who also helps me in terms of these online webinars, that is Shashi Roy. Without any further ado, let us open this meeting with a word of prayer. Father God, we thank you for this beautiful day. We commit the day and this presentation unto your able hands. Let everybody who will be in this forum benefit in one way or another. As your solution providing center, we pray that those who are seeking for solution to meet us and their purpose in this life be fulfilled. I pray, trusting and believing in God's name.
Amen. So let me welcome our representative from our Financial Services Department. Give us a brief introduction of who we are in that sector. So if you are in down in zero, kindly take your 3-5 minutes to introduce.
Okay. Thank you very much. Good morning, everyone. I hope you can all hear me loud and clear.
Yes, we can hear you, Dan.
Great, thank you. I'll be very quick. I've been given this opportunity to introduce ourselves and basically just tell you what we do. And I'll be very quick with that. Allow me to just share my screen. I hope you can see that. Let me just put it on full screen. Right. So I'll go straight to who we are. And today I have the privilege of introducing Liaison Financial Services, which I hope you can hear me. I think maybe you can mute if you're not muted. But allow me to just start very quickly. Liaison
Dan, you're on mute. Kindly unmute.
Great, thank you. As I was saying, thank you for allowing me to introduce Liaison Financial Services, and I was just explaining that Liaison Financial Services is a subsidiary of the Liaison Group, which ideally forms an integral part of a diversified financial powerhouse. And as a key branch of the Liaison Group tree, Liaison Group offers other solutions, including risk and insurance services, healthcare administration, which primarily offers or deals with the enhancing access to quality medical coverage and employee wellness programs such as this one. We offer investment advisory, trust services, and pension administration, which is our main or our core business at Liaison Financial Services, where we specialize in delivering. We specialize in delivering comprehensive financial solutions which are tailored to enhance your financial security and long-term prosperity. So our expertise spans across employee benefits, which is our core business. We are licensed by RBA to offer employee benefit administration. We are also corporate trustees. We do offer corporate trusteeship for various organizations, that is pension schemes, and very soon to offer for financial institutions, that is the collective investment schemes. And lastly, we do offer advisory services, whereby we ensure that individuals and organizations receive top-tier financial management. But going down to our core services, and that is in our universe of services, We, as I mentioned, our core business is administration, where we do management of employee benefits and retirement schemes. We oversight income drawdown funds for retirees, and we do facilitate old age medical plans for continued healthcare security. Secondly, we do offer trust and advisory services, whereby, as I said, we are corporate trustees for retirement and investment funds, and also we do offer expert advisory on pension annuities and investment strategy. So lastly, we do offer support services, that is fund accounting and financial reporting. We do offer member training services and sensitization on retirement planning, actuarial reviews to optimize your fund for sustainability and performance. So we have two flagship products in the market. That is Mafao Individual Pension Plan, which is a tailored pension solution designed for individuals who seek to secure their retirement savings. Here, we do offer a platform for individuals to be able to save for their retirement at an individual basis. And secondly, we have an umbrella fund called the Suluhu Umbrella Fund, whereby it is a collective retirement scheme that offers a cost-effective and professionally managed pension solution for multiple employers and their employees. Here, if you're a small employer and you'd like to take care of your pension needs, you can adhere to our umbrella fund called the Suluhu Umbrella Fund. So in a nutshell, that is the universe of service that we do offer. We operate, of course, in East Africa, Nairobi being the main office. You have financial services in Uganda and Rwanda as well. And of course, we have a footprint across the country, and we offer solutions to various government institutions, to agricultural NGOs and various organizations. So thank you for that. I think that is what I intended to present to you today. So thank you very much, Damaris, for allowing me to introduce who we are at Liaison Financial Services.
Thank you very much, Dan, for that brief introduction of what we do in our financial services department. So at this juncture, we welcome our presenter for the day, Dr. Rajesh, take us through today's topic. So I kindly request that all of you mute your microphone, and in case you have a question, you'll be able to raise your hand or put your questions in the chat box. So Dr. Rajesh, take the stage.
Hello. Good morning.
Morning.
Am I audible?
Morning. Yes,
Yeah,
we can hear you.
You are audible.
Okay. So, good morning, everyone. This is Dr. Rajesh Chaudhary. I am an gynecologist and infertility specialist at Fertility Point, and I've been here for the last 4 years. So, Fertility Point here at 40 Suit at the Upper Hill. So today, the purpose of our presentation is to make awareness about the fertility treatment, and in view of insurance, how insurance people should know about the fertility treatment and its process and its limitations. So we'll discuss about the infertility, its symptoms, and its different treatment modalities, and its success rates. Next slides. So that's my experience. I have an experience of about 12 years now in the field of reproductive medicine, and I have a privilege to have 5,000 IVF babies in India, Nepal, and in Africa. Next. So the understanding the early signs of infertility in women and in men as well. So actually there is no sign, a specific sign of the infertility, but we can predict that infertility could be problem in particular case. Majority of the women suffering from infertility, they don't have any symptoms. But if there are any, there can be some potential signs that can help in early recognition of the infertility. And in such case, if those signs are present, the couple should visit uh, the fertility specialist a bit early and seek for the solution. So these signs are the indicator, could be a potential indicator of infertility, though its specificity is not 100%, but it could be an indicator. So by understanding these early symptoms, we can take proactive steps towards preserving the fertility in time. Next. So the first sign is age. There are misconceptions among many women that they can conceive at any age. And I sometimes wonder that women, sometimes my clients, they come at 50 and then they talk about pregnancy with naturally when they are nearing menopause. That means the reproductive education is lacking in our society and in our books. So women should be aware what is the limitation of their fertility and what time or by what age would be the best time to conceive. So there is something called biological clock where it exists in men and women as well, but in women it is a bit different. So as we know, as women age, the quality of their eggs, they decline, and not only the quality, the quantity also, they decline. So every woman, when they are born with a certain number of eggs, and those eggs are, they get depleted every menstrual cycles. So there are roughly 300,000 eggs in as reserve in the ovary. And from the age of menarche, that could be 12 or 14 years of age, it starts depleting. And by the time she reaches 35 years, almost 80% of the egg reserves are depleted. And by the time by 40 years, only 2% of the eggs are remaining. And all the 98% are depleted. So also the capacity of the uterus, as women age, the capacity of the uterus to hold the baby safely, that capacity is also declined. And also the capacity of the body to cope the pregnancy, they also decline. Like as we age, the chances of gestational diabetes, preeclampsia, and preterm labor, the chances are high in aged women in compared to the young women. So conceiving in old age is a bit risky. The first of all, there would be a high chance of infertility because of the declining egg quality and quantity. And second, there could be a high risk of the pregnancy-related complications. Next. Another sign is the irregular menstrual cycle. So when a woman, irrespective of their age, if the menstrual cycle is irregular, now what is irregular menstrual cycle? Any cycle that is the normal menstrual cycle is 28 to 30 days cycle and plus minus 5 days. So that means 22 days to 35 days. That is a regular menstrual cycle. Anything beyond that is a irregular menstrual cycle. So, but it can be irregularly, sometimes out of the 10 menstrual cycle in a year, 10 to 12 menstrual cycle. If a woman is having 10 to 12 menstrual cycle in a year, that is a normal. But if it is, say, if she's having only 5 to 6 menstrual cycle a year, that is again an irregular menstrual cycle. Out of this 10 to 12 menstrual cycle, one cycle could be a bit irregular. That is called regularly irregular. But if all of the cycles, if a woman cannot predict a menstrual cycle, then that's a problem. So this could be there could be a many underlying cause of irregular menstrual cycle. And it could be because of the lack of ovulation. If she is not ovulating for whatever reason, could be because of the hormonal imbalance or obesity or any medical conditions, then it can lead to irregular menstrual cycle. And when there is no ovulation, she will definitely experience infertility. Similarly, hormonal imbalance, like there could be a polycystic ovary syndrome. As we know, it is very common among women. In general population, it is around 10 to 15% of the women, they experience PCOS. And among infertility patients, almost 30% will have PCOS. So it is pretty common in infertility patient. Similarly, if there is a thyroid problem or any hormonal issue, like if the prolactin level is too high, then she can have an irregular menstrual cycle. Also, a very lean and thin patient, woman, if the BMI is too low, then she can experience irregular menstrual cycle. The craze to have a thin and lean body, that can lead to hormonal imbalance and irregular menstrual cycle. So, and sometimes there could be underlying conditions in the ovary and in the uterus, like fibroid or endometriosis or adenomyosis. This can lead to irregular menstrual cycle. Also, among what we have observed, almost 1% of the women, they experience premature ovarian failure. That means they experience menopause a bit early in their late 30s or early 40s. They experience menopause. So what we call is premature ovarian insufficiency, and it could be genetic, and it could be related to some kind of autoimmune disease. And this is pretty common among Somalian population, where they have very low AMH or very low egg reserve in their ovary, even when they are in their 20s or in their early 30s. So they experience infertility. So infertility is pretty common among those patient group as well. So diagnosing those things, like if someone is having a risk of premature ovarian failure, then they can start completing their family a bit early if they can come to know that these things are running in their family. Next. Another sign is irregular, apart from irregular menstrual cycle, if the cycle is regular but it is very painful menstrual cycle, then that could be a sign of endometriosis or deep endometriosis, which can lead to infertility. And this, as we know, endometriosis is it cannot be cured, and it can just be contained for some time. And pregnancy is the best treatment for the endometriosis, where endometriosis symptoms can be hold for some time. So actually, what is endometriosis? As we know that the uterus has 3 layers. The inner layer is the endometrium, where the implantation of the embryo happens, and then the myometrium, and then outer layer. And then there is a ovary, there is a fallopian tube in the pelvic, in the lower abdomen. So this inner layer of the uterus, they get migrated to the other part. So that is a migration of the endometrium to the myometrium, or to the ovary, to the fallopian tube, or to the other organs, even in the liver, or even sometimes, rarely, it can be in the eye also. So this is called endometriosis, where the woman will experience extreme pain whenever she will be menstruating, because Menstruation is the shedding of the endometrium, and wherever this endometrium abnormally located, they also shed. So if the endometrium is in the liver, even the liver will bleed, and that can lead to the pain. So this how it is, how it could be bad. It can be present, this abnormal tissue can be present in the bladder, leading to the painful micturition. It can be in the rectum, leading to the very painful defecation. So this is a very severe, it is not a cancer, but it is a very progressive disease. So this symptoms should be known, aware to the woman, and early diagnosis is important so that we can control it even before it gets worse over the time. And there are medications and surgery available to contain this disease. This leads to the inflammation and scarring of the very vital reproductive organ, and this can lead to the infertility. Next slide. If you have any questions, please text it, and then later we can answer to it. Now, hormonal imbalance, how to know that hormonal imbalance is there, is that if you experience some kind of irregular menstrual cycle, obesity, or very thin body, or the neck is humped neck, and then acne, pimples, not only in the face but also in the chest. If there are pimples, if there are abnormal hair growth in the face, then that is a sign of hormonal imbalance. So most common hormone imbalance are related to the PCOS, some kind of thyroid dysfunction, and prolactin imbalance. So in thyroid, as we know, it plays a very crucial role in regulating the menstrual cycle and ovulation. And imbalances such as hypothyroidism and or hyperthyroidism can disrupt this process, and this can lead to infertility. PCOS is another very common hormonal disorder that affects women of reproductive age. It has a very wide spectrum of symptoms like irregular periods, ovarian cyst, high level of androgen that could be like that is responsible for acne and hair growth, and this all can interfere with ovulation and even implantation and infertility. So prolactin is another hormone. High level of prolactin will suppress the ovulation, so she may not ovulate at all if prolactin is high, and periods can become irregular. Next. Now, this is another important, very important cause of infertility, pelvic inflammatory disease. And this is one of the most common cause of infertility and common cause of tubal blockage and among women in younger age group. So any history of, in the young age, in the adolescent group, any unsafe sexual encounters, sexual histories, any unsafe abortions can lead to pelvic inflammatory disease. So that health awareness is important among adolescent girls, how to prevent themselves from PID and possible infertility. This awareness is important. So PID is actually an infection of the female reproductive organ, that is uterus, the womb lining, the fallopian tube, even the ovary, the vagina. These are the reproductive organs. So PID is the infection of those organs, and the most common organs are chlamydia or gonorrhea or even tuberculosis. It can lead to inflammation and scarring of those organs, and it can lead to very bad infertility. And if the infection is there in the womb lining, the infertility is so bad that she may land up she can never conceive on her own uterus, and she may need surrogacy. She may need to hire uterus of another woman. what we say is surrogacy. And this infection over the time, if it is not early diagnosed and treated, this can lead to a scarring. So if a woman has a abnormal foul-smelling vaginal discharge or lower abdominal pain, and in their adolescence, it's better them to visit a gynecologist earliest and get diagnosed and get treated with appropriate antibiotic. If this disease is treated early, then the scarring effect can be prevented and she can conceive. Infertility may not happen, but if the treatment is delayed, infertility can happen. So this is how bad this infection is. And this can also lead to ectopic pregnancy. If the severity of the damage is not that bad, it's just mild, then she can still conceive, but it can lead to the ectopic pregnancy. That means the pregnancy is not in the uterus, but outside the uterus. So, and that is a life-threatening condition. Next. Now, another sign is unexplained weight change or unexplained weight. If the BMI is too low or too high, then this can be a reason of hormonal imbalance, such as PCOS, and this can lead to infertility. So being overweight or underweight, they disrupt the hormone balance and ovulation. And when there is a excess body fat, mostly in the lower abdomen or thigh, then this can lead to insulin resistance. So excess body fat is not good for men or for women as well. So in men, when there is excess body fat, this can lead to more estrogen in their body fat, and more estrogen. Estrogen is actually a female hormone, and that female hormone in men means that he's losing his masculinity. So his testosterone will go down, his sexual urge all the time will go down, and his testis to manufacture sperms will also go down. So body fat is not good for men either, and not good for women either. And then irregular period is another. What this could be the reason the high BMI can lead to irregular periods, and excess weight can also lead to ovulation problem. Either low BMI or very low BMI or very high BMI can lead to an ovulation. Next slide. So when should a couple or a single woman looking for a pregnancy, they should consult a specialist. Now, a specialist is someone who is a specialist in infertility. So, as you know, how an infertility specialist becomes is after having a basic medical graduation, the doctor goes for the 3-year course for specialization, and then after which he becomes a gynecologist. And after doing that, if he further takes another training course, another course of for reproductive medicine, that's how he becomes a super specialist in this field. Now, however, the infertility practice can be conducted by a gynecologist as well after the short training. So it's important that a couple who is suffering from infertility, he should know where to go and where to go to get their problem solved. So she can visit a gynecologist, general practice gynecologist, or she can visit a fertility specialist. Now, when she should visit a gynecologist is when the couple knows that they are having a problem in conceiving. Then for the basic test, for the basic diagnosis, they can visit a gynecologist. So a gynecologist should conduct a basic test to which is semen analysis and a test, a hormonal test, and ultrasound in the female, and the ovarian reserve test. And depending on the diagnosis, the gynecologist can then treat himself or can refer to the specialist. Now, if there is a persistent infertility, if age of the woman is less than 35 years, and if she has tried for pregnancy for 12 months without any contraception, and she is not conceiving, or if her age is above 35, then she should not give more than 6 months. And if she is more than 40 years, she should not give more than 3 months for natural trial. And if she is still not able to conceive, then she should go to a specialist or a gynecologist. Second, if she has already underlying conditions like PID, if she has a history of pelvic inflammatory disease in the past, if she has undergone abdominal surgery like surgery for appendix or cesarean before, or any kind of surgery that can lead to a scarring, after when a skin is cut, or whenever there is a cut in the organ, it leads there is a healing, and in the healing process there can be a scarring. Now this scarring in the reproductive organ can lead to infertility. So any previous history of lower abdominal surgery can lead to infertility. So if there is a history of that, and then there is a history of very irregular periods, painful periods, then she should directly go to a specialist. Now, again, if there is a failed treatment by a gynecologist, if a gynecologist has done a basic test and have conducted some treatment like some medication, through some medications, or through some maybe IUI as well, then she should go to another level of treatment to a specialist. Next slide. Now this is, as we know, this IVF journey is very emotionally and financially, it is very painful, and we never know when this treatment ends, whether it can be a success within a year or it may take 10 years. So this is very difficult scenario for a couple, and this very stressful time as well for their family life, their sexual life, their financial life. As you know, this is a very financial draining process as well, and emotionally draining process also. Now, if a woman is a job holder, and then if she is continuously in family pressure or stressed, then even her job is affected. So in that way, it affects all aspects of the life, infertility. And so while she is going through the journey, the treatment journey, she should know how to tackle her body, how to tackle her mind, so that she remain a bit stress-free. So there are few technique of that, like practicing mindfulness. So one should understand that one cannot control everything, and whatever is under her control, she should take a stress of that only. That's what is mindfulness, and also doing meditation and deep breathing exercises to reduce the stress. But most important thing is realization, self-awareness that there's no benefit of stressing self on what you cannot control, and leave it on the treatment part, on the doctors and on the God. Next is seeking for the therapy. If this is mindfulness exercise is not enough, then she can visit a psychologist. Here at Fertility Point, we have a psychologist who offer this therapy, and this is they have to go through a session of counseling, and then that helps. Then there are this group of women who are suffering from infertility, they are a bit cut off from other part of the society, even with their relatives. So they form their own group who are suffering from the infertility, and then they share the things, they share their pain and feelings, and where they feel a bit better. Unfortunately, these support groups are only for the women's, men. I don't know. They have a bit of ego and all those things. I've never seen men having their groups and talking their, sharing their feelings. But women, they are pretty good on this, and they share their feelings. And there are so many support groups online, in the WhatsApp, in the Facebook, where they share everything. And then actually this helps other women based on their experience of the other people. They take a lesson, and then they know when to go to visit a doctor, and where to visit, how to get help. These all things are helpful. Next. So now, once your woman your couple realize that she is having a difficulty in conceiving, then she needs to navigate. So, this is a very complex journey filled with hope, anticipation, and failure as well. In 50% of the case, the success rate is 50% in one attempt. So it's a very painful journey. So this presentation aim is to provide a clear and supportive roadmap for individuals and couple who are considering for IVF treatment. So they should navigate. They should empower themselves with information and knowledge. Each woman and each couple should empower themselves. In the era of internet, you can gain information, and even from the support group, you can gain all the information, and this will empower you with knowledge, and then this will prevent you from getting exploitation as well. So navigation is important. Next. So this we have discussed. What are the causes of infertility? Mainly in female, let's see how in organ-wise, like three important organ is uterus, the fallopian tube, and ovary. Now each three organ has a different role. The uterus is to hold the baby, is for the implantation and to grow the baby over the 9 months. The cervix is another which helps in the delivery. The fallopian tube is like a bridge between the sperm and the egg, and the place where the egg fertilizes, and the fertilized egg grows to the embryo. This is what the fallopian tube role is. And the fallopian tube nourishes the fertilized egg to become an embryo, and then also transporting those embryo back to the uterus for implantation. And ovary, it provides the gametes, the egg. So egg and sperm. Let's understand like this. A doctor is like a farmer, and there is a seed and there is a soil. So for a plant to grow, we need a farmer need to select a good seed, and there should be a farmer should prepare the soil as well, plowing it, watering it, and then sowing the seed at the right time, at the right place. So that's what the seed is, the sperm and the egg. The soil is the uterus, and we are the farmer. So now here, the ovary is a seed, and there can be a problem in the quality of the egg. The ovulation problem, there can be endometriosis in the ovary, and this can lead to infertility. Similarly, the fallopian tube, which acts as a bridge between the egg and the sperm, it can get disease, it can get infected with PID. So it can, so the egg and sperm doesn't get an opportunity to meet, and this can lead to infertility. Similarly, uterus, if there are fibroids adenomyosis. If the womb lining is infected, then even the embryos are made, it will not allow the embryo to get implant. So these are the cause of infertility. In men, the cause of infertility is the low sperm count, poor sperm motility. But this low sperm count and poor sperm motility, they are the manifestation of a disease. And this could be a varicocele, this could be some genetic disease, this could be a obesity as well. So when obesity can lead to poor sperm count as well. So these are the different causes of infertility. Next. So once a couple is there in the clinic, what a doctor does is do the basic test, and then based on that, do a bit advanced test as well. So there will be an evaluation. The evaluation will mostly be a simple semen analysis, and then there would be a assessment of the ovary, uterus, and the fallopian tube by blood test and by ultrasound and by HSG as well, sometimes a laparoscopy as well, or hysteroscopy. So after doing all these tests, then we come to the conclusion, what is the problem? Sometimes the problem is one. Sometimes the problem is more than one. Sometimes the problem is only in the woman. And in 50% of the case, the problem can be in men as well. And sometimes in 1/3 of the case, both men and women can have a problem. So it could be a multifactorial. The problem can be in uterus and can be in fallopian tube, both, and can be in men also. So there can be a couple who is having an infertility, and after doing the test, then we see that husband is also having a very low sperm count or no sperm, and the wife is also having a problem in the uterus and a problem in her egg. So depending on all these things, then the treatment can be offered. So suppose there is a mild problem, like the semen count is mildly affected and the woman doesn't have any problem, then this can be solved by a simple medicine or by IUI, that is intrauterine insemination, where sperms are washed and then put in the uterus during ovulation time. And if there is a problem, if there is a severe sperm decline, or there is no sperm, but the sperm is there in the testis, then they have to go for the IVF, where we recruit the sperm directly from the testis, if it is azoospermia, and then we stimulate ovary of the woman, and we do the egg retrieval, and we fertilize the egg through a needle, because the sperms are poor, so we have to force the sperm to enter into the egg, and then we make an embryo, and then we do the embryo transfer. So depending on the problems of the man and woman or the couple, we offer the treatment. Now, what if the uterus is severely affected with infection, so womb lining is not developing, so still now then they have to go to the IVF if there is egg and a sperm. So we harvest the egg, we take the sperm, we fertilize it, and then we offer them a surrogacy. Now, if there is a premature ovarian failure, if the egg count is very low, or if there is a repeated IVF failure because of the poor egg quality, then we offer them a donor egg IVF. So that donor egg IVF, again, we take an egg from a donor, and then we fertilize it with a partner sperm, and then we implant it into the wife uterus. So this is how the IVF, there are different aspects of the IVF in itself we go into. But in overall, how the IVF works is, the first, there is a collection of the egg. So generally a woman, they ovulate one egg in one cycle. But in IVF, we need more egg so that more embryo can be created. So how we create a more egg is by ovarian stimulation, where she will go for ovarian, subcutaneous injections with IVF hormonal injections for 10 days roughly. And then in between, we monitor them with hormones test and ultrasound. So we monitor their egg growth, and roughly on 12th day of the treatment, we harvest the egg, what we say is egg retrieval. So eggs are collected, and then those eggs are handed over to the embryologist in the lab. Now, what the embryologist does is ICSI or IVF, where the sperm are then injected into each egg, and then we put it in the incubator in the lab, and then next day we check the fertilization. So after keeping the fertilized egg for 3 to 5 days, then we have an embryo. So roughly, if there are 10 eggs collected, we can have 3 embryos, because not all egg they become embryo. So like just not all egg become a chicken or hen. It's not all egg they become an embryo, and not all embryo will become a baby, or not all embryo will implant. So this how why there is a the success rate of IVF is 30 to 50% depending on the different factors. Next. So this is preparing for IVF. So we do a blood test, we check routine test, hormonal test, and HIV and hepatitis test. We do uterine evaluation. And then the common medicine that IVF injections are mostly the FSH and LH. So this, I think I have explained before slides. So, and there are different protocols of ovarian stimulations, and depending on the ovarian reserve and age, we decide which protocol to go, and then the treatment is actually tailored based on the patient need. Next slide. So when the embryos are cultured in the lab, suppose we get 20 egg after the egg collection. So the embryologist will check those egg under the microscope, and they will denude it. The egg has a layer, outer layer, which will be removed, and then they study the egg under the microscope, high resolution microscope, and see if it is a mature or not. So roughly out of 10, 8 should be mature, like 80% should be mature, and if it is there, that is considered as a good stimulation protocol outcome. So there is a rule of 80. So out of 10 egg, 8 should be mature. Out of 8 mature egg, which is injected with the sperm, again, 80% of the 8 should get fertilized next day. That is, say, 7 or 6 should get fertilized. And out of that 6 or 7 fertilized egg, again, 80% should go to the day 3 stage or day 5 stage. That's like, say, what we say at the end, we get 2 to 3 good quality embryo. So we transfer 2 to 3 good quality embryo under the guidance of ultrasound. And this embryo transfer is a very pivotal steps. It's just like sowing the seed in the soil. If that technique of sowing the seed is not good by the farmer, it will not germinate. No matter how hard work he has done in plowing, in preparing the soil, or in selecting the seed, the process will not be successful. And this should be a very quick process and very painless procedure. And the embryo has to be transplanted in the endometrium, in the womb lining, exactly where it should be. So, and it should be released very smoothly from the catheter. Excess use of force can lead this embryo to go into the fallopian tube instead of in the womb lining, and then it can lead to ectopic pregnancy. And if the process is a bit painful, then uterus being a very sensitive organ, it can lead to the contraction of the uterus, and then the embryo can get expelled through the cervix, leading to negative results. So embryo transfer is very important. And now, after the embryo transfer, there is a wait time of 2 weeks before the patient go for the pregnancy test. And during this 2 week wait time, she can resume a normal life, a healthy life. She can go to work, but she should avoid strenuous activities, right? And then controlling yourself, emotional support is important. It is also important that she should not undergo any kind of stress, because stress releases bad hormones, and then that is not helpful in the implantation. Next. And also, it's important that as a doctor, I give them right information. I tell them all the chances of what are the chances of the pregnancy. And then also, like, we have found that many women, they consider it as 100% sure shot technique to get a baby, but in fact it's not. It's that, as I said, the chances of success is 50%. So in the most favorable condition, it is 50%. And it could be as low as 5% also. Sometimes women, they come at the age of 45 and then they ask that I want IVF by my own egg. And then the different studies have shown that the chances of getting pregnancy at the age of 45 with her own egg is just 5%. So as an insurance person, you should know that it's like an investment. Like, you are investing $500,000 to the clients for IVF, and then the return of investment is just 5%. Then you should not allow that. Even we don't advise patients to go for self-egg IVF. We tell them to go for the donor egg IVF, where even if at the age of 45 uterus is okay, then using a donor egg IVF, the chances of pregnancy is 50%, 50 to 60%, which is good enough. So that giving an expectation is a right to information, and not raising too high expectation to the patient is important. Next. Now, the another question for you, to facts to know for insurance, people are to know how many times you should offer them the IVF treatment. Now, there are many countries they offer three IVF a year. Israel, they offer 7 IVF under insurance. Canada, they offer 3 IVF, I guess, 3 IVF. And in UK, they offer IVF 3 times in lifetime, 3 times, but that depends on the lottery system. Will come on the first basis. So in different countries have a different policies for giving insurance coverage for fertility. And now recently, as we know that the USA, Donald Trump has is covering this. The government is covering the IVF treatment for the patient. So these are the and then there are loan assistance, then cost-saving measures like a mild stimulation from our side. Like, we can do a mild stimulation where we use a less cost or less injection, so that the price of the cost of the IVF is a bit low. But that doesn't mean that we compromise on the quality of the egg. We focus more on the quality than the quantity in that case. So financial consideration is a very significant role, and it is actually a roller coaster. When a woman who are at the age of 30 comes to know that she needs an IVF, but she cannot go for IVF because she don't have the money, then she waits for 1 or 2 or 3 years. And then, as we know, one-time attempt has a 50%. So at the age of 33, she is able to fund herself. And by that time, she has now a compromised egg quality, and then that also increases the chances of failure. So again, she waits for another 2-3 years. Now that's how the lack of finance can lead to a permanent infertility. Now, if she has undergone the IVF treatment at the age of 30 itself, and then the quality of the egg at that time is a good better, and then that could have lead a higher chances of getting pregnancy. This is how the finance plays a role in success as well. So how the insurance company should come forward in covering this curse to this is a curse to society, actually, the infertility, and this is also a burden to the economy in the sense that when a couple is not able to focus on their job, on their work, the productivity is lost. So overall, the country economy is on loss. Next slide. So for the infertility patient, they form a group, and through Facebook or there are so many networks. They share their experience and then they give advice. So and then there's the personal network also. So it's better you share the problem to your friends and family, take their guidance, and who knows, they can help financially also if you share this problem to your parents or to your family members. So sharing is caring, and also seek a professional counseling for your problem on time. That is more important. And like many women, they postpone their pregnancy for the purpose of career. Now, this is another reason for infertility. Now, there can be a biological reason for infertility, like you can have an infection or you can have a PCOS under which you don't have a control. But there are invitations. Few people, they invite infertility. They invite infertility by postponing their pregnancy because of the career or the studies, whatever. So this is the social reason of infertility. So if for somehow reason, if you have to postpone the pregnancy, then there is another option of preserving your fertility by going to the egg preservation. So you will not come to know all these things unless you share the things and unless you have a personal network, So that's why even if you are not infertile, you should be a part of this fertility group, to know what is there actually and to know. Next. So these are our teams now. We are a team of 4 now, actually. We are 4 IVF specialists located in different parts of the Kenya. Dr. Sona Kanwala is located in Parkland Clinic. Myself is located in Fortisut, where we have a lab. Dr. Awale is an IVF specialist. He's in Kisumu, and now we have in Mombasa. So next slide. So these are our centers in Kisumu, Parkland, and Upper Hill, and in Mombasa. Next. So thank you. So we are at the end of the beginning and not the beginning of the end. That's what a very hopeful message.
Thank you very much. So we are still in time, and we can try to answer questions in the chat box. You're able to check. One of the questions is that Ameva is asking, up to what age do you advise one to do IVF with donor egg?
Sorry, I couldn't hear you.
At what age should someone seek IVF with donor eggs?
Okay, so what we have to understand that the egg quality that declines with age, and we have to understand what are the percentage of the pregnancy at different age, provided that there is no other factor. Like if the egg quality is bad, and if the sperm quality is also bad, then even if you change the egg, pregnancy may still not happen. Now, if the womb lining is not good, if the soil is not good, and even if you change the seed, that is the egg, with the donor egg, the pregnancy may still not happen. So first, the appropriate diagnosis is important. What is causing the infertility? Sometimes we come to know about the problem after doing 1 or 2 cycles of IVF. Everything looks okay, but unless we go ahead and put our foot in the pond, we don't know how deep is the water. So, but now, up to the age of 32, the eggs quality are good, considered good. Now, after the age of 32, the egg quality, they decline. And not only the egg quality, also the egg quantity also they get declined. So one should try to get pregnant before the age of 35, because as we age, there is a change in the genetics of every cell. So is the egg. So chances of miscarriage and chances of abnormal baby, like suffering with Down syndrome, that increase after the age of 35. And definitely when we see the age, like there's no cutoff point, but after the 40 years, the take-home baby rate, the live baby after the age of, from the age of 40 is like 10%, 5%, 3%, 2%, like 40 years, 41, 42, and 43 years. It's 10, 5, 3, 2. So that means at the age of 40, if you go for IVF, out of 100 women who have tried for IVF at the age of 40, only 10 will have a baby. Another next year, at the age of 41 year, out of 100 women who are at 41 year, only 5 will have a baby, healthy baby. That's how it is. So I will suggest try up to the 40. 10% it's okay to try, like okay, take a chance. But if you have a limited budget, if you cannot afford your IVF treatment next time, then it's better to take a chance that can give you a 50% or 70% chance, that is donor IVF. So it all depends on your how much you can take the risk and how much fund you have. But definitely, no matter even if you are rich, I would not suggest to go for cell-to-egg after the age of 42 years.
All right, Elena, I can see your hand is up. Go ahead. Elena? Okay, Mukada? Mukada, we can't hear you.
Yeah, so this is what I'm for the insurance companies. What my suggestion would be, like while drafting a policies, like I mean, if you are funding for infertility IVF treatment, and then it all depends how many times you can fund it, 2 IVF or 3 IVF, and at what frequency a year, 1 IVF a year or 2 IVF a year, and then you have to draft a policy. Like you have to tell the person, like if you are 42 year, then we cannot give you to permit you to go for self-egg IVF, because it's all also like if there is a high chance of failure, then next time after failing, she will definitely come to you again for the second IVF.
Hello.
Hello.
Okay, my name is Nkatha.
Yes,
Okay, I have a
Nkatha.
friend who has a blocked fallopian tube. So this friend of mine has done a procedure to correct it. She has been on medication and decided to do IVF. So she has had a IVF thrice and it has failed. On your presentation, you've mentioned that there are some factors that can cause IVF to fail, and the success rate is 32 to 50%. Is there any other solution? Because this friend of mine has tried IVF thrice and it has failed. Is there any other solution that can make her conceive?
We have to first see what factor is causing failure, whether it is a egg factor or whether it is a uterus factor. If the uterus is not in a good shape to accept the embryo, then no matter how many times you transfer the embryo, it will always fail. So first we need to find out whether it is an egg factor or uterus factor. If it is an egg factor, then we need to change the egg from a self egg to the donor egg. If it is a uterus factor and if it is not correctable, then she may have to go for the surrogacy. But if it is correctable, like if there is a fibroid or some immunological causes, sometimes there can be immunological causes that can reject the embryo, then she can again consider for next IVF.
Okay, thank you.
Does someone with PCOS, can one be able to conceive with such a condition?
Yeah, if there is a PCOS and if there is no other factor, as I said, that there can be more than one factor. There can be a PCOS, there can be a blocked fallopian tube, there can be a low sperm. The husband is not able to make pregnant because of the poor sperm. Then the management becomes different. But if there is only a PCOS, then it can be controlled by hormone, balancing the hormone through lifestyle changes and some medications. And first she should try with losing her weight if she is obese, and some medicine like inositols or anything. That depends on how imbalanced is the hormones, how obese she is. Is there any androgen is high or not, like the hair growth or pimples, and then whether she is ovulating or not. Now, most of the women who are not ovulating or who are having delayed ovulation, like cycle is very prolonged, that means a delayed ovulation, then by simply losing a weight by 10%, like if she's 100 kg, if she lose her weight by 10 kg, then there's 50% chance that she will resume her ovulation, or by taking some PCOS medicine. So this can help. Now, if that doesn't help, then she may have to take ovulation-inducing medicine, and then she can go for IUI or self-drive for 2-3 cycles. If that doesn't succeed, then IUI for 3-4 cycles. If that doesn't succeed, then go for the IVF. So this is how it can work.
Okay. How many, given the failure rates of IVF, how many times can one try again, and does someone have to pay for the second part of the first failure to survive?
Sorry, I didn't get it. Will you please repeat?
Given the failure rates of IVF, someone has tried for the first time, will she again pay for the second time, or how many times do you allow someone to try?
Okay, good question. Yeah. Now, if you go to a restaurant and if you have a lunch and if you again go for the dinner, do you have to pay again or not? You have to, isn't it? So in the same way, now that cost will cover you for the first cycle of IVF. Now for the second cycle of the IVF, you have to pay again. Now that depends. If you need a new group of embryo, then you have to pay for the injections and everything, the whole IVF cycle. Now, but if you have already embryos left from the first IVF, and if it is frozen, then you have to pay a part of it, a part of the IVF cycle. That is just, you have to pay for the embryo transfer process. And that's almost the 50% of the IVF cost.
Okay, so another question here, someone is asking whether you are get insurance for hormonal test. I think this one, it depends on your insurance cover.
Yeah, it depends on the insurance.
Yes. And again, another one, to what extent does liaison cover IVF treatment? This one also depends on your cover. It differs scheme to scheme.
Yeah, so let me share you one thing. 4 years back, there was only one insurance company who were covering the fertility treatment, and that was TSC only, the minute. I mean, now, here we have now almost 8 to 9 insurance companies. They are either fully covering or partially covering, or some are now if we consider some are covering even for the fertility test, only fertility test. Now, if we count that, then it will go beyond the 10 insurance company. So this is how the things are changing now all the time.
All right. So from the chat box members, you can also check out from fertility point. They have given us the specific call of the specific gynecologist to check on in case you have an issue. And we are going to share this presentation before close of business today with the recording, and because of time, let me take this opportunity to thank all of you who joined, and our facilitator, Dr. Rajesh. Thank you very much for the good delivery of your message. So you can now leave and see you in our next month. Thank you.
Okay, thank you. Thank you for having me there. Bye.
Thank you, guys.